Tonight, there is a growing push to add another weapon in the fight against COVID-19.
And here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Great to see you, Dr. T, as always. Since the start of the vaccination push, we have been rolling up our sleeves, but many scientists are now pushing harder to develop a nasal spray version of the COVID vaccine. It may sound simple, the question, why is that important?
Right. So, Eddie, obviously the vaccines, when you inject them, it gets good antibodies in your blood, but in the nose, back of the nose, your mucous membranes where the virus comes in, the antibodies aren't so great there. The hope is if you can give a nasal spray that you can elicit a good antibody response locally and then perhaps protect the virus from entering the cell or protect the body from having the virus hijack our cells. And in doing so, perhaps we can decrease our risk of infection and then transmission. We really need to do that because right now it looks like we're just dealing with COVID around the clock.
Right.
So we need to put an end to that. That doesn't necessarily mean that we'll do away with the injections, but perhaps we need to, really add to our toolbox and add these mucosal vaccines. The good news, there are about 12 candidates around the world. About 4 of them are about to go in phase 3 trials. We have to see if they're effective now.
Yep.
So effective, you have to wait to see that. But do you think that that option, if it becomes available, would help address people who are hesitating to get vaccinated?
Oh, I hope so, Maria. Vaccine hesitancy, as you know, it's still so prevalent. I just had a patient yesterday that was in a high-risk group but hadn't gotten any vaccines to date. His BMI was 32, and in fact, what he said is, if I'm going to even consider these vaccines, I want to wait till I lose weight and get into better shape. You know, that's not the way we want to think about it. We want to get these vaccines into our highest risk people early on. But with that said, we have to work with people. We may not agree with their decision, but over time, hopefully more and more people will, take this vaccine.
And Dr. T, speaking of vaccine hesitancy, the number of young kids getting their shot still isn't really climbing, but new research shows that the vaccines for younger groups are 83% effective in preventing hospitalization. So it would seem statistically to make sense, but they still aren't climbing.
It's an important study that you're referring to, Ed. This was just published in the New England Journal of Medicine. Over 250,000 kids aged 5 to 11 in Singapore. Some of them weren't vaccinated. Some of them got a single dose of the Pfizer vaccine, and many of them got 2 doses. And what they showed is that overall there was an 83% reduction in hospitalizations in those that received 2 doses. So it was excellent against preventing severe illness. Not as great against preventing infection. About 65% with PCR positive confirmed cases. But the bottom line is when you hear us say, even in a younger, healthier population, when you hear us say that there's a significant decrease in severe illness, please listen. We now have strong evidence to prove that. And in the U.S. right now, only about 30% of kids aged 5 to 11 have received both doses. So we have a long way to go here.
Dr. Todd Ellerin, thank you so much, Doctor. Be well.
Great to see you, Dr.
Thanks, guys.
T. Have a good weekend.